Okay, nice to see you, Dr. Piggott, and nice to see everyone here on the line with us today. Thank you so much for joining us. Apologies that we're just a few minutes late here. I will start us off with a land acknowledgement, and then I understand that Warden Jones only has a few minutes with us today and wants to share a few messages. So once I've completed that, I will turn it over to him, and then we'll hear from Dr. Piggott. Okay, let's take a moment to collect our thoughts, and we'd like to respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so let's actually start off with Warden Jones, and then we can move on to our board chair's opening remarks. So go ahead, Warden Jones.
Well, thank you very much for accommodating me. I just have another meeting to go on. The world is full of meetings anymore. I just want to thank everyone for all the great work they're doing through this next phase of what we're going through. It was a real pleasure to meet Dr. Piggott. We had a little visit just last week, and I think he's the perfect guy for the job, and we all need to get behind him and support him. One thing we just completed today, actually, is what we call my COVID champ. I mean, we're so used to hearing negative things going on and down in the dumps over all this stuff, but what we did, we joined together with our friends at Curve Lake and Hiawatha and the city and the county, and we got together and picked some COVID champions. And these are people who have gone that extra mile to help us through this COVID situation. You know, not everything has to be doom and gloom. We need to look for all the positives we can. So the winners of these beautiful gift baskets will be announced in the near future. So that's just something we can do because, as I like to say, we are all in this together. And in that case, we were in it together. So Peterborough County, we're doing the very best we can do to put all the safeguards in place. Many of our staff are already working from home, those who can. So we're on that road to cooperation, and let's all work together and get rid of this situation. The vaccination, as we know, is the only way to go. And I sure wish everyone would listen to that message and not come up with their own definition of what to do. Anyway, that's it. Peterborough County says thank you to everybody. Keep up the hard work, and we'll get through this. So thank you very much, Brittany, for putting me ahead of Andy. I kind of like that the odd time, Andy. So now you can go ahead if you want.
Thank you so much, Warden Jones, and thank you for your wonderful words of encouragement. They're certainly needed at this time. Okay, I'd love to turn it over now to our board chair, Mayor Andy Mitchell. So please go ahead, Andy, with some opening remarks.
Thank you very much, Brittany, and thank you, Warden. I want to begin by being very honest with everybody. I'm tired and I'm frustrated with COVID. Seems that no matter what we do, it doesn't end. The trouble with the virus, however, is that it doesn't get frustrated, and it certainly doesn't get tired. It just keeps infecting family, friends, and neighbors. Despite what we may wish to be done with COVID, it is not done with us, and the battle continues. Peterborough Public Health's approach is a targeted one, has three parts, and we have been deeply reflecting and focusing on avoiding significant economic and social disruptions. Part one, as the warden mentioned, is vaccinations. One dose helps, two is better, and for those 18 and over, three provides the best protection, especially against the Omicron variant. Peterborough Public Health is ramping up its efforts, adding new vaccination locations in both the city and the county, adding new appointments, and adding new resources and partners in the effort to get needles in arms as quickly as possible. Our goal is to ensure that those between 5 and 11 get their first shot, that those 12 and over who have not yet been vaccinated get their first and subsequent shots when eligible, and that those over 18 with 2 shots get their booster vaccines as soon as possible. The second part of our strategy is to accelerate access to rapid tests. Distribution centers are being set up across the city and the county. These tests will allow individuals to better determine that they are not transmitting COVID when interacting with others. Please consider using them for yourselves and to ask those who are attending holiday and other gatherings with you to do the same. The third is making informed risk assessments. Although this is done at the provincial and regional level by the province and Peterborough Public Health, with appropriate measures taken, each of us also needs to make our own risk assessment when considering our interactions. Key questions to ask are, am I at risk because of my age, underlying health condition, or other circumstances? Are the people I intend to interact with vaccinated, symptom-free, and recently tested? If I am unsure of other people's status, will I be gathering in a well-ventilated area? And if physical distancing is not possible, will those around me and will I be wearing a properly fitted mask? It is also important when assessing risk to consider those you live or interact with regularly. If your household includes older adults or children not able to be vaccinated, you may wish to choose to limit your contacts to a greater extent than if you were just considering yourself. Our community has weathered a string of storms in the last 21 months, and we will weather the Omicron variant as well. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, so let's take a look at our current situation, and I'll now turn it over to Dr. Piggott to walk us through these next few slides. Please go ahead, Dr. Piggott.
Thanks, Brittany, and I'll talk us through our situational update before sharing some general remarks. We currently have 59 active cases in the region, including 10 new cases from yesterday, 2 of which were Omicron cases, and there have now been 4 Omicron cases detected in the last 2 days. On the next slide, you can see our case count by date. And you can see that this number for the week of December 13th so far is already 23 cases. And it has been increasing. If you look, we are appearing to have a week that will outpace the last one as well. On the next slide, you can see the breakdown of cases by age, and of particular note is how many cases there are in the under 20 population, many of whom have not been vaccinated yet, especially the 5 to 11-year-old age group. On the next slide, you can see that we currently have 3 active outbreaks, and these are all related to youth settings. I want to note that we have completed booster doses in all residents and most staff for our long-term care homes to protect this vulnerable population. And congregate settings remain a key focus as Omicron is starting to circulate. And we're also very pleased to see the new measures to increase protection for our elderly that the province has put in place. On the next slide, you can see a map that shows the rate over the past 14 days, and you can see Peterborough's weekly incidence is up to 28.4 from 25.7. On the next slide, we can see the dramatic differences in case incidence over just the past 2 weeks, with greater zones entering a purple area, and it is at this point only a matter of time before we do as well, which I'll talk about shortly. The cases dramatically differ by different parts of Ontario, so I would encourage careful consideration and caution as we're approaching the holiday period to travel even in other parts of our province. And on the final slide here, we have our vaccination data as of our end of day yesterday. So if you look at the graph in the middle, the bottom pink one, the overall vaccination rate among those 5 and older with 2 doses stands at just around 80%. And third dose uptake is now improving, especially among older adults. So this is very encouraging, and we are doing everything that we can to continue with immunizations and our immunization scale up. I'll speak about that shortly, but I want to start by sharing concern. I am worried, and it takes a lot to worry me. I've worked in a conflict zone, I've worked in the emergency department, but I have not been as worried as the time that I am now in what we are faced with the Omicron wave of COVID that is approaching. People are tired. People are tired of COVID, like Mayor Mitchell said. And this complacency and this fatigue is coming at exactly the wrong time. It's coming exactly when we need people to be the most careful and at our darkest moment in the pandemic to date. We are in the breach of exponential growth of cases in this province from the Omicron variant. And as you can see from the provincial modeling from the Ontario Science Table that was released just a couple hours ago, with no additional measures, we are about to see exponential growth in this province of Omicron cases. With no additional measures, we will see up to 10,000 cases a day in Ontario by the end of the month, which may translate to hundreds of cases in our local region. And I'm deeply concerned because we know the measures and we know what to do. But the pieces that we can control at Peterborough Public Health are only so much. And the measures that people will take and the decisions people will take coming into these holidays are really what will impact our trajectory over the next couple of months. I want to talk about some key priorities, but I need you to hear that the actions and decisions that you take now and over the holidays will greatly impact the situation and the Omicron wave in the coming days, because I'm concerned that people are not nearly concerned enough, and I'm concerned what that will mean for our community. The most important thing that we can keep doing is vaccination. You need a third dose to now consider yourself protected, and we are working as quickly as we can to get vaccinations out. We have been vaccinating individuals in the 50 plus group who've been able to book appointments since this past Monday. And beginning next Monday, individuals 18 years and older will be able to also book appointments. We have been scaling up our efforts and diverting all our attention and resource to vaccinating, because we know with what is coming, vaccinations, booster vaccinations will save lives. We have stopped nearly everything that we can in order to divert resources into this. And on Tuesday, I mentioned that I had given our team an ambitious goal of increasing the number of appointments that we're offering for vaccination by 5-fold. And I'm pleased to say today, for next week, we've been able to get up to a 6-fold increase in the number of vaccine appointments that we have to do boosters and to accelerate this, given what is coming with Omicron. Eligibility for vaccine is shown on this slide, and the interval has now been decreased to 3 months. So if you are able to get your third dose booster, I implore you, please get it as soon as you can. And we are working to add more appointments as quickly as we can in order to get this protection out for the community. A reminder, you must make an appointment at this stage for booster doses, and that can be done through the provincial booking website or through your local pharmacy that may be offering it. Vaccination, though, will not be enough. And I want to talk a bit about the other two items that Mayor Mitchell mentioned around testing and around risk assessments, because the decisions that you make will impact transmission of COVID. Testing will be a really important tool over the next couple of weeks, and rapid antigen tests are being distributed in the region, in both the city and in locations in the county in the coming weeks. They can also be purchased commercially online, and they can provide a peace of mind knowing that you are negative before you may gather with people outside of your household. Thousands have also been handed out to students with instructions in use over the holidays, and I'm very hopeful that these will be useful and helpful, because if people know that they are going to see people outside of their households and they test themselves, if they test positive, I trust that people will stay home, and that will help to mitigate the spread of Omicron and of COVID. It's important to use them, especially before coming into contact with people who are vulnerable, including people who have not yet been vaccinated, including children under the age of 5, or elderly populations, or people with medical risk factors that will make them at higher risk of severe COVID. Finally, I want to talk about risk, because this is what people are thinking about now: is what will the holidays look like for me? And we have a strategy for you to approach this that starts with consideration of local restrictions and provincial measures that are in place, ensuring that you are vaccinated and that you are gathering only with others who are vaccinated, and recognizing that there is still a risk of being infected and transmitting with 2 doses. And so booster doses are important to the consideration of vaccination. If you are sick, please stay home, get tested, but also utilize rapid testing for your decision making over the holidays. It will help. Finally, if you are going to see other people, consider time spent outdoors, whether it's time going for a walk, time sitting around a fire, having a hot chocolate, whatever it may be. If you can spend time outside, it's going to be safer. Finally, if you are going to be gathering with other people indoors and you're meeting the guidance limits that are in place at the time, please consider continuing to wear a mask throughout the entire duration, and think, is taking off your mask, is having a sip of that drink or a bite of that food really worth a risk of transmitting COVID? Additionally, ventilation we know is really important to decrease the spread of COVID. So in addition to keeping on a tightly fitting mask at all times that you can when you're with people outside of your household, consider cracking a window, opening a door, even 10 minutes every hour, and getting the air flowing, because that will decrease the risk of transmission of COVID. There are a few pieces from a service disruption standpoint that I want to mention, because we are, like I said, in an all hands on deck approach to vaccinate as many people as we can. That means that we have redeployed and temporarily reduced services in other parts of our operation. For instance, routine inquiries by telephone will no longer be offered starting tomorrow for a temporary period. We are ensuring that our website is up to date, and please, if you have questions about it, consult our services on our website, or speak with a healthcare provider. And thank you for your patience as we're trying to roll this out as quickly as we can. I had the fortune of spending some time this morning with our staff in the vaccine clinic, and they are incredible. They are doing wonderful work. It is running smoothly. They are doing as much as they can to protect our communities. So thank you for your patience when you are there and getting your own vaccine. And please book yours if you haven't already. If you're unable to immediately book, keep checking back, because we're adding appointments as quickly as we can. So again, I want to finish with this. Please be reflective, and please think carefully over the coming days and weeks. What we are faced with the Omicron cases that we're seeing increasing in our own health unit, but especially around all of Ontario, is deeply troublesome and deeply concerning. And your actions will have impacts on transmission. So please stay safe. I wish you a happy and safe holidays to you and your family. And I'm obviously happy to take any questions as well.
Thank you very much, Dr. Piggott. Okay, so before we hand it over to our media guests, we are fortunate to have some of our elected officials joining us today. And I see Mayor Therrien, and it says Office of MPP Dave Smith. So if that's Dave Smith, we can certainly hear from you too. But let's start with Mayor Therrien. Did you have any messages today, or you just want to be available for questions?
I will be available for questions, and I just would reiterate the messaging that we've heard from the warden, from our medical officer of health, and from the board chair about being smart, thinking through decisions, and doing what we need to do to limit the spread of the variant and the virus in our community. So just would reiterate that messaging.
Thank you very much, Mayor Therrien. Thanks for making the time for joining us today. Okay, is that Dave Smith with us on the line? Did you have any comments for us today, Dave? I'm not seeing anything. Okay, well, we can come back if I get a note that he'd like to say something. So with that, I will turn it over to our media partners. And let's start with Paul Rellinger from Kawartha Now. If you've got some questions for Dr. Pigott, Paul, please go right ahead.
I do, Brittany. Thanks so much. Thank you, Dr. Pigott, and thank you for your bluntness. I think that's particularly needed right now. Just one question, and I'm not even sure if you can fairly answer this, but how close, based on what you're seeing, based on what you're hearing from your colleagues, how close are we to returning to the restrictions we had at the worst time of the pandemic? It sounds like we're inching closer every day, and I know that's a question that's on the minds of many people.
Thank you for that question, Paul. And it's a difficult one because nobody wants to hear this. Nobody wants to hear the truth. We had all hoped that with rollout of the vaccine and with how wonderful the uptake, quite frankly, has been, that we would be through this. But that is increasingly appearing not the case. There are still a lot of unanswered questions about Omicron that will become more clear in the coming days. There certainly has been a signal that perhaps it is less severe in South Africa, but now looking in other jurisdictions such as Denmark, that appears not to be the case. And we are seeing with just how transmissible this is, even if for some people it is less severe, it may cause very severe disease and death in people who are vulnerable, unvaccinated or not fully vaccinated. That means that the vaccine is not enough and other measures are needed to help to control its spread.
Thank you for that. And just one more thing, and correct me if I'm wrong, because I often am. Can you act unilaterally on your own to decide what measures need to be put in place for our region, despite what we're seeing province-wide? If you're alarmed enough, can you take those steps yourself?
It is something I'm looking at very closely. There are legal levers under the legislation for those kinds of local decision making. I want it to be aligned with our context and situation. And we're fortunate to have case counts that are somewhat lower than the provincial average. But with an exponential growth, that means doubling potentially as quickly as every couple days. So our 10 cases could become 20, could become 40, 80, 160, 320 in a matter of mere days, and it can change very, very quickly. So in addition to the current context, I'm trying to very closely follow the situations that others are experiencing in the province. And while it's important to be aligned with other jurisdictions and the province, I am very closely considering what other additional measures may be needed to protect our population.
Thank you so much, Dr. Pigott, and I wish you and your family all the best the holiday season as well, and stay safe, and we'll see you in the new year.
Thank you so much.
Thank you, Paul. Okay, let's hear from Global News. I see Jessica Niznik is with us today. Jessica, do you have some questions for Dr. Pigott?
I do. Thank you, Brittany. Hi, Dr. Pigott. There's been talk about, I also sit in on HKPR's meetings. And yesterday, Dr. Bocking said that a regional approach to this is not enough. We need, she said if the province isn't going to implement more measures, that she will have to. Why do you think it is that, I know it's hard for you, it might be guessing, why do you think the province isn't taking these steps?
I think that everyone is tired of this and everyone wants to not look at the modeling and information that we're being given and not see the future that I think we are very close to. I'm tired of this. We're all tired of this, as Mayor Mitchell said. So I get that. I get the public's fatigue, but now's the time that we need to be the most vigilant. And I certainly hope that we will have the leadership that is required to coordinate and protect our population and our province from the spread of Omicron.
So thank you, Dr. Piggott. If you were to take a step further, you've reduced, you've asked people to work from home. We've been doing that here, and the restaurants limiting. What do you think would be your next logical step if you did have to implement something?
We try to seek to use the evidence on transmission in the measures that we take, because like Mayor Mitchell mentioned as well, we are trying to be as minimally impactful on the economy and on society as possible while protecting the public. The areas where we're seeing the most transmission is both in certain public businesses and gathering sites, especially where people are eating and drinking and not wearing masks, as well as in private gatherings. I think a lot of people are still treading with significant care, but there are parties and things happening where people, I think, are forgetting the reality and the situation. So those are a couple of the areas that we would be looking at based on the evidence of the highest risk. And we are looking actively at measures that could be in place to provide the protection that we need.
Okay, just two more, Dr. Piggott. Is there any word on when the third dose? Are we going to need a third dose to be considered fully vaccinated? It's a lot of people are wondering.
I don't know when that guidance will change from the impact of being able to go out and use your vaccine passport to different venues. But I want the public to understand that this is a 3-dose vaccine and you should not consider yourself fully protected with 2 doses. A third dose is needed for the protection. And I think that's the most important thing that matters at this point.
Great, thanks. And just one more. You mentioned a little bit of a disruption in services, and that I know you're redeploying everyone as you need to, but I believe you said the phone lines. Is that what you said? The phone lines won't be answered?
Yeah, some of our phone lines associated with some of our general inquiries will be set up to redirect people as needed as we're redeploying all of the administrative and other help that we can within our organization to doing vaccine work.
Okay, I just worried about saying we've got a lot of seniors. I'd say seniors are majority of our viewership who love to make phone calls. So I just wasn't sure what to tell them if they don't have a computer and they need information. What would you say for them?
So the biggest focus is around vaccine questions and vaccine appointments, and the provincial process to booking will still be available with phones and the ability to answer many of those questions. However, this is a temporary measure. We have increased, like I mentioned, by a factor of 6 the number of vaccine appointments, and that's through an all hands on deck approach. So the provincial vaccine number, which is 1833, I think Sarah's just put in the chat here, but 1833-943-3900 is their best way to get questions answered about the vaccine at this time until we do reinstate these services, which I'm hoping will be very soon as we're able to adjust to this increased work.
Perfect. I'll make sure to let people know that. Thank you so much, Dr. Piggott. That's it for me.
Thanks for the questions.
Thank you so much, Jessica. I see Reg Watson has put up his hand, so let's hear from you, Reg, if you've got some questions.
Just a question. I've heard reports in other regions of Ontario that there are being pop-up walk-in clinics already for the third dose booster shots. Just wondered if the health unit is planning on trying that in the future, or trying to find locations and staffing to be able to do that.
Yeah, thanks for the question. Walk-in clinics are ideal. It's it's the easiest, I think, for accessibility for appointments, and we'll get there as soon as we have the capacity to do so. Unfortunately, at this time, even though we've increased again by a factor of 6 the number of appointments we have available, there is still a massive tens of thousands of people who have become eligible for vaccine, and if we had them all descend, that would be dangerous and harmful in a walk-in clinic format. So at this point, we are having to restrict to appointments for those booster doses. And as soon as that can change, we will. But I'm anticipating at least into the end of next week, people will have to have an appointment. If you're having trouble booking an appointment, again, that can be done online or by telephone. And I'd encourage you to keep trying back, because we are adding appointments every day. And even just today, we've added a whole large amount of additional appointments.
Okay, thank you. I'll pass along to colleague Bill Hodgins.
Thanks.
Go ahead, Bill. You've got some questions.
Yeah, just a couple. There seems to be a huge demand for the booster. Do you know, will they be clinics held on Christmas Day, Boxing Day, any of the holidays over the holidays?
We're looking at all of the dates in the coming weeks. I'm not sure on those specific dates at this point, but next week alone, we've added over 9,000 additional appointments, 9,390 appointments we have scheduled.
Okay, and my second question had to do with the rapid testing. I've never had one. I don't know what's involved with them, but I do hear some concerns now that they're going to be more readily available, that people are afraid there'll be some people hoarding them. So I was wondering if you can maybe offer some advice on, if you're offering them free, how many you should take, or is there a concern about testing yourself 5 times a day? I don't know.
Well, I think fairness and sharing and access is important, because the province is giving out a number free of charge, and we had the locations earlier, and I think that will be very important for people to be able to access these. If you can afford to do so, they can be purchased commercially online. I don't think that this is something that people would benefit from hoarding and benefit from multiple times per day utilizing. But I do think, especially before big gatherings, for instance, on Christmas Day, if you're going to see family members from outside your household, again, that's within our guidance limits at the time, then I think before you do that, having a negative test for all participants is very, very useful. For yourself to do it on a frequent basis is probably not useful, but testing once or twice per week can be helpful in picking up COVID cases. And then again, the most important thing is, if you do test positive, to stay home.
Do you know if any of the locations where they're handing them out, if there are a limit on how many per person?
I'm not sure. That's a question for Ontario Health, who's managing the distribution of this.
All right. That's it for me. Thank you.
Great. Thank you so much, Bill. All right. Well, last but not least, we've got Matt Latour with us today from Oldies and Freak Radio. Go ahead if you've got some questions, Matt.
Oh, there we go. Now I'm unmuted. I got a couple questions, and if they were answered, I apologize in advance. I've been kind of in and out of the meeting. I know you mentioned that appointments are needed for the booster shots. I know there's still a section of the population that hasn't had a first or second dose either. Do they have to book appointments now as well, or can they still walk up?
I believe we're at a walk-in appointments for those populations. Correct, Sarah and Brittany?
Yes, that's correct.
Thank you so much.
Perfect. And my next question had to do with the timeline for a booster shot. I know it feels like we've been hearing minimum 6 months throughout, and then yesterday the Ontario government said 3 months for anybody 18 plus. Was this kind of a surprise to you to hear? Is this something that that you agree with, or do you think it should have stayed with the 6 month interval?
Well, I'm assuming that the provincial decisions around this are coming from evidence and guidance. We haven't heard from from NACI, Canada's National Advisory Committee, on this piece yet, but I know that the evidence was showing that people who were closer to 5 and around 6 months out were starting to be more vulnerable in the face of Omicron. So I think it's important to decrease the interval. What I think is critical, and what I very much hope in the coming weeks, is in the face of Omicron, we need to vaccinate those most vulnerable as quickly as we can, especially our 50 plus and elderly who are older, including 70 or 80 plus, who haven't had their booster dose yet. It's incredibly important that we get them out and vaccinated and protected, because there will likely be protection with 2 doses, perhaps not against infection with Omicron, but likely be good protection against severe disease and death. But we know that that 3rd dose is really needed. So at this point, we're following the provincial guidance, and we're going to do everything we can to ramp up vaccine appointments, because this now opens up a very large proportion of our population for a 3rd dose. So we're going to do that as quickly as possible, but I think it's very important that those that need it most get it first.
Wonderful. And I saw the post this morning of you volunteering at a vaccine clinic. Is this something you plan on doing a lot more, as the clinics ramp up?
Oh, it was great to be there with staff. It was the highlight of my day for sure. I'm there on the weekend again too, and definitely as I have some time, it's not the priority, but it's nice to be out there with staff. It's a good pickup for me and for staff, I think. And it was nice to see how well the clinic was running for sure.
Wonderful. That's it for me. Thank you, everyone.
Great. Thank you very much, Matt. And thank you, Dr. Pigott. Okay, so one more quick announcement from me, because I think we have worked our way through all of our media guests, and then we're going to sign off. But just to let you all know that we are going to move these briefings to a weekly basis as the situation with Omicron is changing and evolving very rapidly. So I will be sending out an invitation to everyone to join us back here on Thursdays at 12 noon as we ramp up to a weekly schedule. So stay tuned for that. And again, thank you all for your continued participation and helping us get the accurate messaging out there. Okay, Paul, did you have a quick question before we go?
I did, Brittany. Sorry. Do you know when the next one will be? Like when those weekly meetings will start?
Oh, so December 23rd, so a week today.
Okay.
Okay, and then we actually will pause between Christmas and New Year's, and then we'll start up again on January 6th, which is the following Thursday after that, and then we'll continue along as needed on the weekly basis.
Perfect. Thanks so much.
Okay, great. So stay tuned for those invitations. Thank you all again. Do stay safe out there. Get your 3rd dose if you haven't already, and we will talk to you soon. Thanks again.
Thanks, Brittany.
Thank you.
Thanks, everyone.